Hi, everyone. It's Dr. Erin with the KMC University HelpDesk. Today, we're revisiting a topic that comes up time and time again with the help desk, and it's the concept of medically necessary care versus clinically appropriate care. You can think of it as the difference between what's medically necessary to adjust versus what's clinically appropriate to adjust. And we can go back and forth on this because a lot of us feel like the entire spine should be adjusted, right? But it's pretty simple. And the bottom line is that in order for us to bill for the services that we provide, those services have to be medically necessary. So let's start by talking about what medical necessity means. There's 4 components. The patient must have a complaint. So we'll use the example of cervical spine pain. So the patient presents with cervical spine pain. Perhaps this person has cervical spine pain that travels down into their left arm. So you, as the doctor, must have objective findings to support that complaint. So we have subluxations at C5 and C7. We have taut and tender fibers in the cervical spine. We have reported pain and dermatomal changes down the C5 dermatome. The third thing is the patient must demonstrate functional deficits in their day life that's associated with that complaint. So the patient must also report subjectively, I can't really use my left arm. I can't lift it above my, up to my shoulder. I can't grab things off a shelf. So they have a functional deficit associated with that complaint. And then finally, you as the treating doctor, you have to come up with a plan of care for that complaint. And that plan of care needs to include a few things. We have to have a diagnosis. We have to have a frequency and duration of care. We also have to have functional goals related to the issues that the patient is experiencing that's related to the complaint. It also has to be related to the area of the body, so in this case, the cervical spine. And then we also have to discuss the services that we're going to provide to the patient. Are we going to adjust? Are we going to use modalities? We need to put all of that together in order to appropriately bill. And those 4 things create medical necessity, which again is what's needed to bill for services in this instance. So if all of those things are in place, then your treatment is considered medically necessary and therefore billable. But what happens if during the exam you come across a lumbar subluxation or an ilium subluxation? Well, then it may be clinically appropriate to treat those areas. So let's go back to that example. If during your exam with this patient, you also find a lumbar subluxation or a subluxation in the pelvis, you have findings associated with that. So from a clinical perspective, it is now clinically appropriate to treat those areas, but we don't have the other pieces that make it medically necessary care and therefore billable care. What we have is compensatory, a compensatory subluxation potentially. So it's still okay to treat those areas, but without all of the components that come up with that create medical necessity, we can't bill a third-party payer for those adjustments. So I hope that it clears up a little bit the difference between medically necessary care and clinical appropriate care. Medical necessity has multiple components that put together a nice, complete picture of the patient's complaint and then what you're going to do about it, versus clinically appropriate care, which is like, hey, here's all the pieces that tell me that this area is in dysfunction and needs to be treated, but it doesn't quite have that nice little bow on top that puts everything together so that you can be reimbursed for that care. Thank you so much for watching today. And if you like this content, don't forget to follow us on all of our social media platforms to learn more from the chiropractic compliance and reimbursement experts.